Every woman needs to know the answer to this question. So the question is, what strategies can I use to work with my menstrual cycle versus against it? Well, I have a real passion for helping women understand that their body is a miracle and that there are beautiful natural rhythms to our physiology, ebbs and flows of life, and working with our natural rhythms is so much more harmonious and effective and productive than working against our body. And so I love this question. What can we do? Let me explain a little bit more about the menstrual cycle. So we always count a menstrual cycle from day one, which is the first day of bleeding, and bleeding can continue for 5, 7, that many days, whatever that is for you. Bleeding's usually heavy at first and then lightens off. And during that time, follicles are being recruited on the ovaries. So the follicles start being recruited right from the beginning of that cycle, and estrogen is being secreted from where those follicles are recruited. And then in the mid-month, usually around the 14th day-ish, there's a peak in some hormones and ovulation occurs. And from what's left behind in the ovary, the corpus luteum, an increase in progesterone starts to happen and the estrogen falls off, and then both hormones fall off and bleeding happens on day one again. So we know that when estrogen is climbing in that beginning part of the cycle, we have a bit more energy. We actually feel a little bit better overall. We feel energized, and there's a sense of well-being. And with ovulation, it is also an energizing sense of well-being. Sometimes there may be little cramps or middle schmerts or some symptoms around the time of ovulation that can change that, but ovulation is usually a time of energy and feeling great. And then in that latter part of the cycle, usually about a week before the period, as the progesterone climbs or as the hormones both start to fall off, there can be some changes. There can be a bit of a low a low mood. There can be some difficulty sleeping. There can be a lack of energy in and around that week prior to the period. And then usually when the period starts, besides the cramping that can come with periods, or for some people, they can have some other symptoms related to the release of prostaglandins, like cramping or bloating or bowel changes, or for some people, even some nausea and vomiting. And all of that can be reduced with prostaglandin inhibitors, and the most common one is ibuprofen. So ibuprofen is actually a prostaglandin inhibitor. So if you've been advised to use Advil or ibuprofen, it's not just for the cramping, it's also to reduce the prostaglandins and to reduce the symptoms that can also reduce blood flow. So ibuprofen or Advil or some version of that is sometimes really helpful for those symptoms. And so if you're asking about how do I actually use these cycles, then you track your periods. You can use an app, you can use a calendar, you can know when your next cycle is coming. And if you're someone who knows your body really well, you'll see that in that last week before your period, or 3 to 5 days, or whatever it is for you, you just feel low. And though that's when you want to go for long walks, you want to do maybe less intense exercise, or maybe you love really intense exercise around that time to get a bit of an endorphin rush. And then you just allow yourself the time and the rest that you need in that latter part of the cycle to prepare for what's coming next. So if you plan your activities for the follicular phase or around the time of ovulation, and you avoid that last few days before your period's going to start, or if you're someone who has a painful period, you avoid the days of your period, then you'll be able to use those ebbs and flows. Now, I've always told my daughters there's nothing that you should avoid doing during your period. If you use tampons, you can go swimming. If you use a Diva cup, you can go swimming, those kinds of things. There's nothing you should avoid necessarily, but listen to your body. If you're crampy, you're feeling tired, you're unwell, that's okay. I give you full permission to listen to your body. Now, what's really important to understand is you don't have to have a period. So you can actually take medication, so a birth control pill, for example, all the way through that and then not have a cycle. So as an OBGYN, I can tell you it's very safe to do that. I can tell you there are actual medical and clinical benefits to being on a birth control pill. and to suppressing your menstrual cycle that may be helpful for you. So if you're someone who is already taking a birth control pill and you just want to take the active pill all the way through the period, you won't get a period. That's called amenorrhea or continuous cycling, and that is perfectly safe. And for a lot of people, it's survival, because if you're going out camping or you're military and you're going in the field or you're going on vacation or you're going on a honeymoon, you don't want to have that period. So I'm here to tell you that you don't have to have your period. There are ways to skip it that are very, very reasonable. Birth control pill is just one of them. So I'm giving you a little bit of permission to listen to your body, to enjoy the harmony of your beautiful menstrual cycle. And don't forget to subscribe, like, and follow the Ask the Doctor series.